Our distinguished guest on the show today was appointed as the Commissioner for Science and Technology in August 2005 during the tenure of Asiwaju Bola Ahmed Tinubu, and he retained this position when Governor Babatunde Fashola assumed office in 2007. He was also appointed as the Special Advisor on Works to the Honorable Minister of Works, Power and Housing in 2015. In September 2018, he resigned the role to contest in the Lagos State gubernatorial elections. Lagos, Nigeria, our guest is a figure who needs no further guessing. He is the incumbent Deputy Governor of Lagos State by the name His Excellency Engineer Dr. Obafemi Hamzat. Your Excellency, you're welcome on the show on Real Talk with Kike today.
Thank you for having me, Mr. Deputy Governor.
Mr. Deputy Governor, thank you so much for taking time out, to be here with me. A big thank you for honoring my invite and coming on the show today, despite your saturated schedule, because I know that you have an heavy schedule. It shows you are not only a man for the office, but you're a man for the people. Thank you so much, sir, for being here.
Thank you for having me.
Yes, sir. So first off, I would like to congratulate you and His Excellency Mr. Governor and the health care team in the fight against coronavirus, the crisis. Your tireless work and you've adopted a lot of strategy that has indeed minimized the effect of the pandemic compared to what other countries are facing today. I said, well done, sir. Thank you so much for helping us during this challenging period of our lives.
Thank you very much.
All right. Thank you so much, sir. So again, I think, Your Excellency, I think it will be important for you to kindly greet our audience as they are all delighted to have you on the show today. That's the
Well, good afternoon, everyone. I hope you're all keeping safe. Coronavirus is real. Please, let's be safe. Let's keep safe distancing. And let's wear a mask. And when we're in public, it is real. And we are losing people, as you know. But we just hope and pray that we will survive this. And
Amen.
But it's now at a phase where personal responsibility is the key.
Absolutely.
We need to make sure we take care of ourselves. So I thank everybody. Good afternoon. And I'm sure you will enjoy the program.
Oh, yes. Thank you so much for that submission, sir. Your Excellency, before we go into the topic of the day, or part of the topics I'm going to be discussing today, which is COVID-19, I think it's important for me. What's your opinion? What's your say on the impact of the growth of democracy in the states and the general development since 1999, using MK Abiola as a reference point?
Well, I mean, I think it's a long story, and we all know what happened. We conducted what everybody agreed was the most fairest and peaceful election, and some Nigerians tried to annul it, and that's what led to his death. But our history is saturated with heroes, people that laid their life for various things. Beko Kuti, Gadefai, they all fought all through. They were not contesting for anything, but they just want a just and a better Nigeria. So we are a nation of heroes, even though we look at ourselves sometimes a bit differently. But there are a lot of people in us that say, no, this is wrong, and they are ready to fight for it. So we just hope that all of us can emulate that. So in terms of the democratic experiment that we are involved in, I think we've all agreed by the Constitution that that's what we want, and that we will elect our leaders and let them determine for us the way to go. It's working, and why it's working is that it allows people to go out there and preach. These are the things I want to do, and it's important for us to actually listen and keep our leaders to those promises. That's what we are doing in Lagos. The things we've promised, we will deliver on them. And we will engage with the community to say, okay, these are the challenges we are facing. If you know it better than us, because we cannot, claim monopoly of knowledge.
Absolutely.
And therefore we say, okay, that's why we get into public engagement. We go with some few days ago, we were talking on Zoom with all the religious leaders. We were talking with all the Obas and Bales and everything. So we are engaging everybody to say, okay, these are thinking. What do you think? How should we do it? Are we making mistakes? Because it's important, if you say democracy is for the people, then it's important that people are engaged at all levels.
Absolutely. Thank
you. So
in
a way, I mean, it's better than oligarchy. It's better than the military experiment.
It's about cooperation.
It's about cooperation. It's about moving us. It's about us believing in our country and our leaders. So, and the moment we can all work together, I see us flying off.
Thank you so much for that. And talking about your office, in the last 365 days, what are the milestones your current administration has been able to achieve? I know Lagos State has a blueprint of work map, and it will be authoritative if the masses can hear from you directly on these milestones.
Well, I mean, you would recall that when we are campaigning, we have what we call themes, which is THEMES.
Yes.
And the T stands for transport and transportation and traffic management, and so on and so forth like that. So all the pillars are what we want to measure ourselves against. So if you notice, one of the things we found out during our research is that roundabouts don't work again in Lagos. You have a vehicular density of over 200. The national average is such about 11. And therefore, a city that is choked like that, roundabout doesn't seem to work. So you will notice that we are removing the Allen roundabout. Yes, we are the first roundabout on Lekki, the second roundabout, the Gondo roundabout, and so on and so forth. So the essence is, let us move traffic a bit more. And therefore, we go around the state like that and start doing that. And then, of course, we are expanding the road in some cases. So in terms of traffic, and we are also injecting our resources into water transportation. Some few months ago, before COVID, we launched 14 new ferries. So and the people using water transportation has risen by, amazingly, by about 1,400%, 1,400% before. So, and we are trying to now bring in the private sector. So we are looking at improving our rail. We are working on expanding the road architecture. And then, of course, we are building our rail. So if we are able to do that, our transportation needs will slightly reduce. We are a small city in terms of land. And we have the biggest population. So therefore, we are crowded. And therefore, we must just manage how we drive, control our driving, and so on and so forth. So in terms of health, well, we can only be defined now by COVID. Unfortunately, so when we knew that it happened in China, we were ready. So we started asking questions, what is it? We knew that if it's coming to Nigeria, most likely to be in Lagos, because that's where the international traffic are. And we know at that time it will be an imported virus. So it's not here, but people will bring it from travel and so on. And that was what happened. So we noticed that the two local governments that has the highest number initially were Ikeja and Etiosa, where people that have the capability to come in, and so on and so forth. So we started building the association center, and then we started preparing ourselves. So what is now important, like I was saying in the introduction, is for us now to take personal responsibility. Let people understand that this is not a ruse. This is real.
Thank you.
Coronavirus is real and it's happening.
Exactly.
So, and various other things on education. I don't know how long I have, but if you want me to go on. On education, one of the things we are doing is in our primary school. We all know that if you get it wrong there, then you are in trouble. So, and you know, we have classes, we have students, we have teachers. We've always focused on all the other parameters, but we've let the teachers alone a little bit. So now we are focusing on our teachers. Part of the reasons why we elongated the holiday then was to train all the teachers in primary school. We gave them an handheld so that they don't have to be preparing teaching lessons anymore or scheme of lessons. So now they have it on the system. Then we can track them, because it's georeference. So the moment you turn it on, we know where you are.
Thank you so much. Thank you so much for that. And I think that is important for me to ask this question, because as you're talking, I'm listening to growth, I'm listening to development, I'm listening to the mega city that you're trying to promote. So my question to you is that Lagos State has the fastest growth and development than other states in Nigeria. Can we attribute it to the economic and human resources in the state? Because I'm asking the effectiveness of the administration. Is the state actually where it should be now in terms of vision and mega city? Because a lot of people are of the opinion that we are not there yet.
Well, I mean, look, the reality is it's always a marathon. So, so development can never stop. You can never be where you want to be. I mean, you can get to a comfort level, but the reality is that if you wait, other cities will overtake you.
Yes.
So we cannot wait. We are not near where we want to be. We are not near. So, but we need to be making progress slightly and slightly. So one of the things that we are doing is to make it easier for private sector to thrive better. Ease of doing business. Because the reality is these are the people that we employ a lot more. You notice that even with this pandemic, we just reconstituted the board of the Lagos State Employment Trust Fund. We brought in people, the former Mrs. Adeshola, the former MD of Citibank, and so on and so forth. Great people, entrepreneurs, people who have done it before, who understands, and interestingly, we brought in a lot of women because they seem to know business better than us.
Yes.
So the reality is, how can we assist all these SMEs, people that can employ 2-3 people? So imagine if you give funds to a company that has 4 people, and you say, well, in the next year, we want you to expand it to 8 people, and you have like 10,000 of those. Imagine the number. You are employing over 400,000 people, and therefore, they will be doing little work within the environment that uplifts. They pay more taxes. You are growing the economy and so on. So those are the things we want to do to improve the economic. Because the reality is that in a state like Lagos, the pie is not big enough. That's the biggest challenge. So our budget is about $3 billion. If you look at the budget of the state of New York, just for transportation, it's $26 billion. Yes. So,
I wish I could delve into the ease of doing business, but let me use this opportunity to wish my adopted mom, Bola Adeshola, congratulations on the appointment given.
She's your adopted mom.
Yes, yes. So going into COVID-19, which is the news of the day, because I know that a lot is happening around that. So we still have the dreaded virus in the midst of us taking lives, because I know that as at few minutes ago, we still got on some people who passed on, which is one of our colleagues, and many other people. It is because those ones are actually celebrated. That is the reason why it's being put out there and all of that. So, sir, kindly use this platform to enlighten the good of the people of Lagos State, to bring them to speed regarding the progress against the COVID-19 and what are the challenges we are still facing regarding COVID-19, because I know that there are some people out there who actually don't believe that it is real. And I'm glad that before you opened the speech today, you actually nailed that on the border. COVID-19 is real. Please enlighten them again.
Well, it is sad that we are losing a lot of people, and may God rest their soul.
Amen.
But it will serve as a reminder to a lot of us that this thing is real.
Absolutely.
And for us to be very careful. If you recall, the Honorable Commissioner for Health, Professor Abayomi, actually explained to us with a model, because what we do is based on the data that we are seeing, hospitalization, people that we are testing. There's a model that allows us to predict. The model shows that by July, we can have close to over 90,000. That's what the model says. So part of our challenge is, how do we make sure that we prove that model wrong? So that we should reduce it. And that's why we are doing everything. Recall that we initially said that churches and mosques can open this coming Friday and then Sunday. But we reverse ourselves. One of the reasons why we saw the trend between then and now.
Yes.
And remember, in a state like in the United States, in the state of Seattle, a church opened, 74 people were in the choir. After they sang, 40 of them contracted coronavirus and 4 of them died. So we don't want a situation where our people will be dying. We don't want. So let's continue to do. That's why we've not opened schools, because schools, people are congested and so on and so forth. So coronavirus is real. However, it's not a death sentence. If people feel the symptoms, please immediately call the number, get yourself to a doctor, and tell them the symptoms. One of the things we are finding out is that people are not being honest.
Absolutely.
So if people don't say, they say, do you have body pain? Say no. So they cannot diagnose you. Doctors are not magicians. They will listen to you, and based on the information, they will do diagnosis. So the reality is, if you go and get a test, we have 20 centers, around 20 centers in Lagos. Go and do the test. We have 7 laboratories now, 6, that can do the test. But we are now trying to get in private sector, another 6 or so that can increase it to 12. But the centers, you can go there, they will collect your sample, they will go and do the test. If you are positive, quickly they can be given medication, and then you can isolate. So people need to really take this serious.
Thank you so much for touching that and for creating awareness on that again. As of yesterday's discovery, I don't know if you saw it, that dexamethasone, I don't know if I pronounced it well, was announced by Oxford researchers as a new cure for COVID-19. I don't know how true it is. Can you put a touch on that?
Well, I'm not a doctor, so I'm not in that. But what I read shows that I'm not sure they say it's a cure. So one of the things is it worked to assist some people. So if you have a chance,
who are the people that it can help?
So let us say if you are, say, 45 to 50-year-old, you are in the mid-range of people that can still fight it. So if you have a 50 chance of surviving it, so they are saying that this drug can increase that probability from 50 maybe to 70%. So it's good.
It's good.
But it's not a cure.
It's not a cure.
You understand? But it helps people to fight it. So whatever we can find, of course, is we will use. But as of now, I don't know. There is no cure, like we know. But the essence is to boost people's immune system, and the best way to boost your immune system is to sleep very well. Sleep well. Eat vegetables. Eat fruits, take your vitamin C, and so on and so forth. Right. So people need to really do that.
All right, thank you so much on that. We're still talking about the COVID-19. So the pandemic is still very much ravaging. And in the lockdown, the figures were minimal by observation by everybody. And in the easing period, the numbers have now increased, which is very alarming, because we can see a lot of people passing on and the likes and all of that, like I earlier said. So is the government actually making the right decision to protect the lives of Lagosians, knowing that Lagos is the epicenter of in Nigeria, and we have lost, as of today, as at maybe a few minutes ago when I checked online, we've lost over 455 Nigerians to this pandemic.
Oh, okay. Not in Lagos.
No. Okay. Yes. No, in Nigeria in total.
So I think you are relating it to, if I understand your question, you are relating it to the fact that lockdown was eased.
Yes.
So you know, we must also look at our society. So the reality is we have a lot of people that they get daily income. So you want to balance it between the lockdown and preventing people from starvation. So we must look at our environment. And that is why look at Lagos State as an example. About 60% of our staff are still working from home.
Yes.
We haven't asked them. So levels 12 down, level 12, 10, and so on are down, are still working from home, except when they are needed. You understand? Yes, so a lot of banks, they see shut down and a branch when they realize it. So the reality is we must start to open gradually. That's why event center has this church. Yes. I just spoke about churches. I just spoke about mosques. So it's not that we've opened everything, but it must be gradual. And see, because life and activity must still continue. We've now realized that COVID-19 is not a sprint, it's a marathon. It will be with us for a long time. That's what everybody says. So because of that, it will now become maybe like having HIV or something like that. So it's something that we know. That's why I said it's not a personal responsibility phase that you and me needs to be careful.
Absolutely.
Look at you are wearing your face guard. Everybody is wearing their mask, and that's the way it's supposed to be. So we need to be careful.
We are the frontliners.
We are the front. So that's the reality. Yes. The reality is we must now be prepared to do the right thing by ourselves. Yes. And if you have the symptoms, please call your doctor, call, and then get the right treatment.
Thank you so much for that submission. Let me use this opportunity to say that please, you can call our phone line 0700 923 923 923. Again, 0700 923 923 923. And you can message us on our WhatsApp 0817 313 6193. Please call us, send your messages. Let's feel your pulse. You have the number 2 in the state that can answer all your questions right now. So, we have a message. Thank you so much. We have a message from Lillian, I guess. It said, good evening. I am Lillian on IG. Concerning the NCDC number, it's really unfortunate that those receiving the call are not truthful enough. I work in a popular hospital here in Lagos as a nurse. My colleague's husband, also a nurse, was diagnosed positive last month. We called NCDC. They never came. They kept promising over a week. He was managed in a room at home since his wife is also a nurse. He got better and is back to work. But the reverse would be the case of the family who have no medical person at home. please shed more light on this. Thank you so much, Lillian, for sending that message.
So I think people should understand one thing. If you call the NCDC number, it's a national number. So it goes to somebody is sitting in Abuja. They will pick the phone call as determine, it's Lagos. They will now call. So we have our own number. It's there, 08000 Corona. So that's the Lagos one. If you are in Lagos, you are advised to call that number. We've said that repeatedly. So if you call that number, at least somebody will get the information. We have a 24/7 call center. There are about 40 people or so sitting in that place answering the calls. So it is important that they call the Lagos number. So if you are in Lagos, it's better you call the Lagos number.
Hello?
Yeah, good evening.
Yeah, good evening. What's your name and where are you calling from, please?
Yeah.
Oh gosh, we lost that. Okay, what's your contribution today?
Yeah, that's the deputy governor. Is it?
Yeah, that's the deputy governor. You're right. Go ahead.
It's good. Yeah, deputy governor, I greet you, sir.
I greet you too.
Yeah, I just want to say one or two things, and that is, I can give you people a very, very big shout out for the way you have managed the COVID-19. I really, really appreciate your efforts. If all other things can go on like this in Lagos State, in fact, it will really become a state of the so-called center of excellence. But I just want to bring up this issue, and that is the issue of transportation. You see, in that area, Lagos State government failed woefully. I thank God you said Lagos has a very small land mass. And that means with 22 million out of 2 million innovation, the transport system has to be nothing but raised and large raised. So the question is, why has it taken 20 years to construct that, or let me know what's it called, to CMS? Why has it taken Lagos?
All right, we could do it. It's saying, why did it take Lagos State 20 years to construct the proper road? Basically, I think that's what I picked from.
Which road is he talking about?
Do we have another caller on the line? Hello. So
you're talking about Lagos Badagry?
Yes.
Well, I'm not sure I understand. I didn't understand your question well, but
all right, sir. So let's drift into welfare of Lagosians, knowing that I'm a Lagosian myself from Olowogbowo Igataiwo, to be precise.
Yeah, right.
So more than 60% of the populace in Nigeria is living below the poverty line, and it was difficult for them to survive during the lockdown. Let's be honest. And I know that somehow it seems like the policy do not favor the masses in the state, going by the COVID-19 crisis. And even before then, we have the issue of Okada and tricycle ban. Sir, what do you have to say to that?
Well, so when you say the policy does not favor,
yes,
so you must first of all be alive,
Benny,
in order to do anything. So the essence of the lockdown is to make sure that we are all safe. You understand? So, and then food were being distributed. Unfortunately, when somebody is given a package, you know those videos that went viral, that they said we should distribute it among 20 people. Who told them to distribute among 20 people? Nobody said that. It's for you. So what we said is, let us look for the vulnerables. So it's, for example, there's
how do you define the vulnerable, sir?
Well, it is available. So for example, if you go to the CDAs, the CDAs, in the people in the community know the vulnerable. They know the elder, the old woman there that doesn't have children. They know, they have the information. When we are trying to track people that came back from overseas and they disappeared, they gave wrong number, we gave the name, we gave the picture. It was the CDA that found them for us. So they know their community. They know the environment. So the reality is, we distributed enormous. We use churches, we use mosques, we use people. So the reality is that we gave everything that we can to people so that at least they can live a good life.
All right, thank you so much for that. We will go on a quick break and return after headline news. But first, a word from our sponsors. Do not touch that dial. This is Real Talk with Kike. All right. If you're just tuning in for the first time, please, this is Real Talk with Kike. You can please call our phone line 0700 923 923 923. Again, 0700 923 923. And you can send us a message on our WhatsApp 0817 313 6193. Your Excellency, thank you so much for still hanging in the studio with us. We're so honored to have you. And let me use this opportunity to say that you are doing a wonderful job yourself and Mr. Governor. And I hope that God will give you longevity. And very soon we will pass through these health challenges that we are going through in the mighty name of Jesus.
Amen. Thank you.
All right, we have a caller on the line. Hello, what's your name and where are you calling from, please?
Good evening. My name is David. I'm calling from Alimashoyi.
Okay. What's your contribution today?
A very big thanks to, the Deputy Governor, Dr. Menta. And, we love the way, the courage, the boldness, and the leadership spirit in them, especially the Deputy Governor in the area of the, of the information. So, but I have a very simple something I want to ask the Deputy Governor today this afternoon. Mm-hmm. And that related to the, the issue of the youth empowerment. For the for the new young business within the state, I'm looking at that there is no solid anything for the youth. For the so many of the youth in the state, we the youth that we have an IDX has been any program for us to achieve our dreams and to contribute our own little together to the state. So, but for so far so good on the areas of the of the infrastructure, I think they are doing a very good job. We have to be sincere with ourselves. If we move around the Lagos state, things are really getting better. And so on the area of the question, what are the plans for the youth, in the state? I think that's my question to be the Deputy.
Thank you so much for your contribution today.
Okay, thank you very much. That's a good question. So what's the plan for the youth? So, honestly speaking, when I speak to younger people, what I say is that youthfulness is not a license. It's just a face. So we were all youth one time. I'm 55 now. I was 20 before. I was 25. So it's just a normal progression. So don't take it as if it's just a license. The question is, what are you bringing to the table? So as a youth, please, I just told you, some last year, between May and December, January, we gave out close to 4,000 loans and then grants to different people. What we found out was, but you must have a plan, a proposal, because we can give you money to say, go and do this business. So the people, we just consider the board. So if you are sitting in front of Mrs. Adeshola, you must know what you are doing. Because, we must make sure that money is not ruined so that we can recycle it and build a lot of people. So what is important is, what do you want to do? What is your plan? Do you have any plan? If you don't have, sit down with people in your community, plan it. The moment you have it, put your proposal it might be 2-3 pages. It doesn't have to be a grammar, too much grammar. Then go there, explain yourself, apply. You can apply, so Google Lagos State Employment Trust Fund. They are there. And for the various other small ones, Women Affairs is helping a lot of women that are doing all these vocational skills. So there are many programs, exactly. There are many programs within the state that youth can plug in. But please, so we are doing all sorts of training, IT. Unfortunately, because of COVID, a lot of these stopped because you cannot social distance. But the reality is, Google this industry, go to Lagos State website. What are the programs there so that you can get involved? Right. And I'm sure that by the end of this, some people will get that advantage and be able to invest money.
All right, thank you so much for that, because it's about government trying to teach them how to fish, not just giving them fish, which is what I'm taking away from this. I think we have a caller on the line. Hello? Oh, we lost that. And I think hello? Can you please speak up?
Honest with you, sir, Your Excellency, the Deputy Governor. We had a very solid proposal. I think, if I'm permitted to say this on the there are some systems frustrating people like us that we don't know anybody. Of a very robust proposal, a solution to the community and to to empower so many people. But you kept on trying, and the system over there.
No, sir, don't let's take this too far. Send it to my office, the office of the Deputy Governor, Alausa Ikeja. Okay? Now send a copy also to, so like I said, go to Lagos Employment Trust Fund. Go to their website. What are their requirements? If you fulfill it, send a copy to them, then copy my office.
Right.
We'll deal
Thank
with
you
it.
so much for that. Hello, we have another caller on the line. Hello, what's your name and where are you calling from? Please be very brief.
My name is Chedu. I'm calling from Lekki.
All right.
Mr. Deputy Governor, I want to thank you and the governor for a job well done. One particular issue, and it's very important, the roads that lead to Ekpe at the Bejuleki local government. It is terrible. Terrible. Please, it's causing so much trouble for the farmers. You guys should help us take care of it, please.
All right, thank you for your contribution.
Well, I mean, I don't know the last time you went there. I agree with you, the road is bad. So the road has failed. So one of the mistakes that we made was we wanted to rebuild. So, and I think we said, okay, let's make sure the procurement, because the road has totally failed, let's rebuild. But why I said we made a mistake, we could have just gone into even do the palliatives before we rebuild. But we thought, okay, let's spend money twice. Let's go and rebuild. But if you go there now, I have a video on my phone. Unfortunately, I didn't bring my phone to the studio, but I can show them. The trucks are putting in base courses now, right now as we speak. So we are trying to rectify it. So, but ultimately, we will rebuild it, but we will do palliatives now.
Thank you so much,
for the observation.
So, talking about population in Nigeria, I know that the population control could be one of the most effective ways to ensure resources and amenities, as in terms of proportionate to the populace. So my question is, what measures is the state taking to ensure indiscriminate entry of migrants into the state? This question, I think I need to elaborate on it, because I know these migrants constitute the population of blast slum areas and underdeveloped part of Lagos. We have the areas of Makoko, Agege, and the likes. So I really want to know, and all these things kind of affect the security in our states.
So let me understand your question. So when you say migrant, people, so Lagos cannot have a visa. So people can come from Ibadan. They can come from Ondo.
I agree.
They can come from Kano.
Yes,
so we are a country.
Yes.
The constitution allows that I can go and live anywhere I like.
Benny.
So if I want to leave tomorrow and say I want to go to Ogun, I won't do that. But if I want to go, I have the right to go. So we cannot stop people, Nigerians, from coming.
Okay.
Except during this time, because of the health issue where the federal government said no, there should be no interstate. But without that, really, we don't have a legal right to stop anybody. However, one of the things we are trying to do, and you mentioned population.
Benny.
So one of the things we are trying to do is, how is it possible that parents are just abandoned children? And those are the issues we need to look at. Majority of the challenges we have today is the breakdown of our families in this country. So we can see what is happening in the north, the Almajiri thing. A lot of state governments are now saying, no, this thing is, you cannot say they will prosecute parents. So you cannot have a child and just give that child. It's just irresponsible. Absolutely. And so part of what we need to do is, how are we maintaining our lanes? Like a friend will say, that we are taking care of our family. The moment that breaks down, that is the bigger issue. So really for now, we are preventing people because of coronavirus to make sure that, okay, why are you coming here, except you are bringing in goods so that we don't keep transmitting the disease. But as a state, constitutionally, we cannot stop Nigerians from coming to Lagos.
Thank you so much for that. I think going straight to infrastructure, I know that COVID-19 has also revealed that low capacity healthcare infrastructures, which is saturated at the moment. What is the government doing to contain the health demands of the teeming population of Lagos State, knowing that we are over 20 million Lagosians right now?
Well, so during COVID, that's why we have 27 general hospitals. That's why we didn't use any of those hospitals as a COVID center, because we realized that, okay, there is COVID, but that doesn't mean people will not get sick. And they don't have COVID. People will still have malaria. People will still have leg cut. People will, various things. People will get pregnant. They want to give birth and so on. And by the way, what we notice is we now have a lot of children during this period. So there are a lot of COVID children, but it's okay. So the reality is that a lot of health things still needs to happen in our hospitals. So that's why we have all those isolation centers. We are getting a lot of hotels and so on, because we don't want to touch on the issue that we said. But COVID has reduced our resources as a state. The only area that we did not reduce is in the health sector. In fact, health sector has actually gone up, while every other sector has gone down. So the reality is that we are building our capacity, we are getting better. You will recall that we learned from Ebola. So when after Ebola, that's why we build the BS lab, the Biosecurity Lab 3. Is the only, well, there are 2 countries that have that in Africa. So we have one in Lagos, we have another one in South Africa. So we built it was about $4 or $5 million to make sure that if anything, because we know another virus will come. Even after this one, we know another one will come. Like maybe 5 years, maybe 6 years, only God knows. So, well, so that's the preparation to make sure that we are ready. And one of the things we are also building is, in 3 years' time, by God's grace, we will have built a permanent isolation center, a 300-bed isolation in Yaba. We will have built an infectious disease institute where you can be doing researches and so on.
With enough equipment. Yeah.
With enough equipment. So that's, we are learning from it. We'll get better so that, by God forbid, if anything happens again, we'll be better prepared.
All right. Thank you so much for that. I know Lagos State has not had an effective public housing policy since the Lateef Jakonde administration, 1979 to 1983, according to many. And he supervised the building of over 300,000 housing units, mostly low-cost estates. I know that there's some opening of estate that was done few weeks ago, but why haven't we been able to surpass that milestone in recent times, considering the fact that the state is richer now in terms of finance and resources? And again, I don't know whether the location of where the housing, is being located. I don't know if it is affordable for the masses.
Well, so you said that the state is richer now.
Yes.
In 1979, my father was a commissioner under that government. So I was aware what was going on. He was the commissioner for transportation. Now, they had, you also said low-cost housing.
Yes, sir.
Let me ask you, is there low-cost cement? There's no low-cost steel. So the reality is that model sustainable? Can we continue to do it? So part of the biggest problem in Africa is not just Nigeria. So when people say, oh, which part of Africa has that been done? It's because our model is wrong. And the model is wrong because we will buy houses as if we go to the market to buy yam or to buy rice. So nobody can do that. That's why every country, England, America, it's mortgage system. The most singular, biggest investment that people will do in their life in America or UK is their house. So that's why you will recall, during the BRF government, we started homes program. Lagos must go up. We don't have the land. So we must go up. We cannot build like we are in Niger State, where they have enormous amount of land and the population is not as big as ours. So we must go up. And therefore, we now say, okay, if you can pay 20% of whatever the housing cost is over 10 years, that is the way. That's how it is doable. So one of the reasons why government cannot do that again is because at that time, there's something called bulk purchase, that they were able to bring in cement. But remember, when you bring in cement from China, whatever, you are giving them job. Today, Tanfules, Dangote, so we must buy it here. And you know the price of cement. So the reality is there, how do we make sure that when you build it today, tomorrow you can build another one, day after you can build another.
And it can't be on the same cost.
It is about mortgage.
Right.
And that's why we have the own mortgage.
All right, thank you so much. For this might be my maybe one of the last questions I have for you. Going to rail transportation, the $1.2 billion rail project conceived under Tinubu Asiwaju and initiated early during Fashola's second term remains unfinished. So what is the clog in the wheel of this rail project?
Money.
I like that.
No, so let us dimension it. So let us look around the world. There is no sub-sovereign anywhere in the world where it is that sub-sovereign that fund rail on its balance sheet. None. There is no state in the world. So look at the tube in London. The majority of the funding is federal. The same thing with America, in New York and the rest. So the challenge is it costs a lot of money. That's why during BRF time, we said let us do the rail, cross over the water, because it's expensive to build, and then it's going gradually. So that's the challenge. Because look at what is happening now. With COVID now, our investment even in infrastructure has gone down. But I told you that it's health and education that's taking a big one. I think we are running out of time.
We are running out of time. Oh gosh, the 45 minutes can never be enough to bring you to do justice to the topic at hand. But thank you so much, Your Excellency, for being in the studio with me. Your responses have been very authoritative, Your Excellency, and I must say that you are doing exceptionally well, and you've deepened the understanding of the state as well as the affairs, and you've brought about the resourcefulness to the show today. Thank you for your time and contribution on the show today. So our parting message courtesy Omoluabi is Ifowoppo. Yes, which means cooperation, which was one of the things that we made mention of earlier, and I think that must be the message for the show today. The society and the world at large can always be better when we cooperate with one another. Let's join hands with the government and ensure that it's progressive and the development remains our priority. Ìtẹ̀síwájú Èkó ló jẹ wá lógún. Thank you, sir. Ajumasheni. Oh, yes. Thank you again. My name remains Kike Lomatondao, and you have been on Real Talk with Kike. Bye now.